Good morning. Today, I will be telling you the history and clinical examination of a typical ENT case. So now, if we come to history taking, you need to remember the mnemonic Socrates. So for each symptom, you basically have to know its severity, its onset, its character, its duration, its relieving and aggravating factors, its time, its timing, and similarly the severity of the disease. Now, if we talk about first the ear history, we need to know, for example, if there is hearing loss in a patient, was it sudden or was it gradual? Is it happening in one ear or in both bilateral ears? And is there any vertigo? Is there any nystagmus involved? Is there any tinnitus, which is also known as ringing of the ears? Is there any pain? Is there any discharge? If there is discharge, what is its character? So these are all the different air questions. Now, in the nose questions, we need to know whether there is unilateral or bilateral nasal obstruction. Is there any history of trauma? Is there any nosebleed? Is there any discharge, which is watery or purulent? For example, watery discharge is predominant in say CSF rhinorrhea, whereas purulent discharge is common other obstructive diseases of the nose. Another clinical symptom is facial pain and loss of anosmia, which means loss of smell. And now we come to the throat history. The major clinical questions are dysphagia and similarly odynophagia and LUMS. These three questions point out towards a differential diagnosis of malignancy. Other questions can be pertaining to sore throat, whether there is any hoarseness of voice, as well as any viral infection. Now, lastly we will describe the general medical history, his medications, his family history, if he has any known allergies. Now we come to the clinical examination. For the ear examination, we do the basic voice test, watch test, the Rini and Weber test to know about the type of hearing loss, conductive or sensorineural. We look for any visible deformities in the ear canal. We look towards the ear. We look towards the mastoid area. We kind of carry out an otoscopy, as well as we do the different types of balance tests. Now we come to the nasal examination. We look for the visible scar marks on the nose, as well as we do palpation to see for any fistula or sinus formation. We get to the anterior endoscopy to look for any polyps, and we similarly do a vestibular examination to look for any parenchyma. The smell test is once again done to test the olfactory nerve. Similarly, we also do the posterior endoscopy as well as the extraocular movement test to test the typical cranial nerves. Now, lastly, we come to the throat examination. The throat examination can reveal several factors such as salivary gland or obstruction, which can be in the form of a salivary gland stone, as well as we palpate the neck to form for check for the Valsalva maneuver and any thyroid enlargement using the tongue depressor. We see if we visualize in the center. We notice if there is any hypertrophy of the tonsils or is there any membrane on it. Similarly, you would look for other clinical diseases such as leukoplakia, erythroplakia, tonsillitis, as well as angular stomatitis. We look for geographical ulcers, apathous ulcers, and geographical tongue. Now, the special tests done are proton audiometry as well as a tympanometry, to categorize hearing loss in those infants who cannot tell it for themselves. Thank you. This was a brief overview of the entire history taking and clinical examination of ENT. I hope you liked the video.